I'd like to explain to you how furring up occurs in a heart artery, because by understanding this, you'll understand what a CT calcium score can and can't achieve, what it really means and what it can't mean. So here we've got a coronary artery, the black outer layer, a sort of pinkish middle smooth muscle layer, and an inner layer, single cell thick, of something called endothelium. Endothelial cells are very important. They're waterproof, and in addition to that, they secrete various substances that regulate the way the heart artery works. Now, there are various things that will damage the endothelium. We know toxins, such as the toxins associated with cigarette smoking, can do that. We know that for some reason or other, certain types of cholesterol can, well, be there as maybe a bystander or perhaps as an initiator of inflammation. And typically, low density lipoprotein, the LDL cholesterol, is critically important here. And of course, high blood pressure. And I don't mean transient blood pressure, I mean hypertension. Chronic high blood pressure over the course of time creates damage to the endothelial structure. Now, let's for a moment remove these issues so that I can draw what's going to happen when the endothelium gets damaged. What classically happens here is the cholesterol circulating in the bloodstream tends to adhere, stick, and deposit in this raw area in the coronary artery, or indeed any other artery in the body. And when it's there, it oxidizes, and that creates a stimulus within the bloodstream for white blood cells to come along and try and gobble all of this up like Pac-Man. Khan from Card Academy really describes this process extraordinarily well. Now, these little white blood cells come along and gobble up all this cholesterol to the point where they become completely engorged, and ultimately they die. And when they die, they release chemicals, we call these cytokines, which tell the body in a way that there's a problem. And what the body really wants to do is cap this area off to protect the heart artery and the blood from chemical reactions that can occur between them. And to do that, the smooth muscle cells start to migrate into this area of atheroma to try and clear this area, and also to lay down fibrous tissue to create this fibrous plaque, this purpley substance that I'm going to draw over this area for you. And this is a way by which the body tries to exclude this atheroma from the blood passing across it to stop chemical reactions occurring between the two. Now, of course, you can see what happens there. There is a reduction in the lumen of the artery. And what can happen is that the blood flow in this region becomes disturbed. You get eddy currents. You get further noxious substances that ultimately create damage to this fibrous plaque. Let's draw that damage into this fibrous plaque to show you what happens next. We get exposure of blood to this area. And this exposure creates aggregation of blood cells, clotting in this area. Now, if it's minor, what will happen is the fibroblasts will come in and they will cap it off again. And with each capping, you see this lumen becomes narrower and narrower and narrower. But ultimately, what will happen, particularly in a patient who has a sudden heart attack, is that this sudden rupture of the plaque creates a sudden clot that blocks the whole of the blood supply to an area of heart that previously was receiving good blood supply, and you have a heart attack. If you have a heart attack low down in the heart artery, you have a small heart attack. If it's high up, you can have a very large heart attack that could kill you. So it's very important to know that if you develop symptoms that don't clear, chest pain, you feel unwell, and you become clammy, this is what's probably happening to you, particularly if you know you've got coronary artery disease. Now, one of the other things that these fibroblasts do, or these smooth muscle cells that turn into fibroblasts do, is they lay calcium in this fibrous plaque, and I've denoted this with these silver areas. This calcium creates hardening of the artery, makes the artery more rigid, less pulsatile, and can worsen your blood pressure over the course of time. These rigid arteries in your body that lack compliance mean that blood pressure becomes an increasing problem as you get older, and that's one of the reasons why. Now, when we put you on a statin, what we believe happens in some patients over time is that This fibrous plaque might become reduced in size somewhat or more concentrated. And what we then see on a CT calcium score is an increased density of calcium. So in actual fact, even though you may not have developed new coronary artery disease or worsening of your coronary artery disease, we sometimes see a phenomenon where the CT calcium score increases after the institution of risk factor controlling medications like statin and other features that we can do to control the risk of you developing a heart attack or stroke. The only real way for us to know how much luminal narrowing is occurring in your heart arteries is to perform a CT coronary angiogram, which is a similar test to the CT calcium score, but in that test we inject radioactive dye into a vein. And that tells us about the integrity of the internal lumen of the heart artery. And even more sophisticated than that is a test called an invasive coronary angiogram. We inject dye down the coronary arteries to look to see how much blockage occurs. So you can see that a CT coronary calcium score gives us an idea of the amount of calcium that's been deposited in your heart arteries as a result of atheromatous disease, which has probably been going on for quite some time for that calcium to be present. And if you've got minor calcium deposition, you'll have a low score. If you've got a lot of calcium deposition, high density calcium deposition, you'll have a high score. And this will give us an indication of what we might need to do to prevent you from having a heart attack or a stroke in the future, but doesn't necessarily give us an indication of how severe your coronary artery narrowings might be. And there are other tests that we talk about in other parts of our video series that will help to answer that question for you. And we've tagged one of those at the end of this video if you're interested. I hope that's helped. Thanks for listening.